Well, hello, welcome to the podcast. As you can tell from the title, we are going to be talking about a controversial topic in the world of wellness or functional medicine, and that is a different approach to cancer. And we all have patients that have had cancer. And I think one of the hardest types of cancer patients are those that I used to get in my early days after my daughter was diagnosed with terminal bone cancer, and then she lived. And so kind of word got out, Rhonda's like the cancer doctor, cancer. I'm like, no, 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 I do not treat cancer. I'm just helping the body be as strong and healthy as it can be. That's my only job. But the thing that was the most sad for me back in the day was I started getting all these patients that would come in. I literally had one guy come in and said, and he came in a wheelchair. His wife brought him and his two daughters were with him. And he could hardly speak. He could hardly look at me. He was so frail and thin. And his wife said his doctor gave him 3 to 5 days to live. Is there anything you can do? And it just broke my heart. But I saw that happen over and over and over back then. I think now there's so much more awareness about alternatives and things that we can do for cancer that were maybe a little bit on the fringe, but when people are so desperate, then they reach out. But sometimes I used to say to them, time is not our friend. There's a point where the time part crosses over and the snowball gets so big that it's rolling downhill so fast that I don't have enough time to get ahead of it. It's not that what I might recommend might help the body be able to deal with cancer, but I can't do it. There's not enough time before the body just says, I'm done. So there is that point. I can't tell you exactly where that point is, but it does happen. And those were always the sad ones for me. I'm like, you waited too long. You should have come see me earlier. I could have helped you. So in Clinical Academy, which if you're listening to this and you are not in Clinical Academy, I'm telling you, friend, this is where you are going to get so much information about how to be an amazing clinician. Every month, we have 2 live calls, and I host both of those calls. One of them is a protocol of the month, and we just pick a topic and we chat about it, whatever that protocol is or a topic. And then the other call is just a live Q&A where everybody gets to submit cases, and I just go through them and we kind of crowdsource them, so to speak. Like it's very interactive. It's very fun. We have a great time. So this last, it was a month or so ago, we did one on cancer and I talked about alternatives for cancer. And I don't have enough time here in the podcast. It was quite the long call. It was about an hour and a half long. And I don't have time here, obviously, but I wanted to give you a few high points about something that is so easy for you to use with your patients. Now, what happens when we get a patient that's struggling with cancer? Obviously, we're not treating, we're not diagnosing, we're not curing, we're not doing any of that. All we're doing is trying to support the body. We're supporting with right diet. We're supporting with immune. We're supporting with getting the right kinds of nutrients in. We are not curing that cancer. If the cancer happens to go away while we're supporting the body, great news. That's what we want. But sometimes it's easy to get out over your ski tips, and either because you don't know enough about it, which really is most of us, or you think, oh my gosh, you need to do this and you need to do this and then you need to take 14 of these and 27 of these, and we need to get you on enzymes and we need to do this and then optimize your digestion and get your liver working. And then we need some milk thistle and then adaptogens for stress. And then pretty soon the poor cancer patient who is already deficient in a bazillion nutrients, right? That's what cancer is a deficiency, a nutrient deficiency disease, really, or toxicity. The body can't keep up with it, doesn't have the right resources to be able to deal with what it's being exposed to. And so we just think, oh, well, I'm just going to shove a whole bunch of stuff at him. And I used to do that too. And the poor patient, I walk away with like 15 things to take. Well, they won't take it. And it's too much because the body's not in an optimal state in the first place, or they wouldn't have cancer. So how do we support them, but do it very simply? And that was kind of the focus of our discussion on the protocol of the month Zoom meeting that we had. So I wanted to talk just a little bit to you about apricot seeds and B17. There's a lot of great information out there about the benefits of B17 and their, presence in certain seeds. And these seeds that contain this B17, it's obviously the best way to consume it because it's already in the plant form. Now, there is a synthetic, I'll say synthetic, it's really a purified version of B17 that's called Laetrile. And you probably all heard of Laetrile. So It's the same and not the same, right? Obviously, we like to get things from food. That's our community. We love that. We love that more natural organic approach. But Laetrile could work just as well. It's just the concentrated form of B17. Now, the most common place that we're going to find B17 is in apricot seeds. You can buy them by the bag full. And let me tell you, they are bitter. They are definitely bitter. I don't mind them because I don't mind bitter things. I've just drank bitters like Angostura bitters or other herbal bitters for so long that I don't even mind the bitter taste. But you can grind them up. You can put them in. Someone said, I read somewhere where they were grinding them up and putting them in like mushroom coffee. You make coffee with mushrooms, or you buy the powdered coffee. I shouldn't say you make it. But yeah, you can put it in there. Someone said you could put it in pesto. You can always grind them up and do something with them, right? Put them in a smoothie, a little bit of smoothie just to get it down. But the B17 that's found in apricot seeds has actually been shown in mice. They haven't done any human trials, but in mice, it's been shown to be very, very effective against the C word. So I have a few notes and I've got a few things written down, and I want to just kind of go over a few things with you just to kind of give you a foundation. Then we're going to talk a little bit about dosing. And then I'll kind of tie it together when I'm done about how you can create a very good supportive protocol for someone who's dealing with cancer. So B17 is found in, as I mentioned, apricot seeds, but it's also found in bitter almonds, apple seeds, peaches, peach seeds, cherries, and plums. So you want to get to the little core inside. So, like a cherry seed, a cherry pit, that's that hard one that we pull out or we spit out when we're eating cherries. You have to crack that open and get the seed on the inside. That's where the B17 is. Okay, that's what we get in these apricot seeds. So, an apricot seed's pretty good size. So if you open that hard nut, it's like a nut almost, you open that, inside's this tiny little beautiful nugget of B17. Now, what the naysayers or the people will tell you is, oh, you can't do that because it has cyanide in it. Well, actually it does. But here's the thing. B17 is metabolized by a certain enzyme, and that enzyme is called beta glucosidase, I think is how you pronounce it. Maybe it's glucosidase. I don't know. But this enzyme breaks down that B17, and it breaks it down into three very distinct things. One is cyanide, the other one is glucose, and the third thing that it breaks it down into is benzaldehyde. Those three things, that enzyme breaks the B17 down into that in the intestinal tract. Once it's broken down like that, the gut bacteria is able to metabolize the cyanide. And that's what they scare you with. Like, oh my gosh, don't eat apple seeds. They have cyanide in them. Do you know how many B17, like apricot seeds you would have to eat or apple seeds you would have to eat to die of cyanide poisoning? Like maybe 1,000. And let me tell you, you're going to have a wicked stomach ache before that ever happens because of the bitters. So there's no way you're going to get any kind of poisoning from these B17 seeds. Now, what they found in mice studies is that it has a very strong anti-cancer function, because what it does is it breaks down the cancer-causing substances in the body. So in other words, it's helping by breaking down the things that are going to be contributing to possible cancer. And it's also been shown in mice to actually kill cancer cells. It blocks the nutrient absorption of the cancer cell. So the cancer cell can't get the food that it needs to continue to grow. So again, if we're talking about dealing with cancer and we're coming from a perspective of, I'm going to support the body, well, this is a great option because B17, we're supporting the body by cutting off the food supply to the enemy, right? We're not letting those cancer cells have the food that it needs. We're using B17 in apricot seeds or wherever you want to get it to help facilitate that. And they've also found that the B17 seems to be really effective with breast cancer, prostate, lung, colon, and rectal cancers. So those are the cancers that they know about, that they've seen it in mice. So with the B17, how are you going to dose it? Well, a maintenance dose would be anywhere from 5 to 7, maybe up to 10 of the tiny little seeds every day. Now, a word of caution here is if you take too many, you may want to start slow with the patient or yourself. Just try them out yourself. I'll put a link in the show notes where you can get the B17 seeds, good quality B17 seeds. And I'll also put where you can find the capsules of B17 that are concentrated. If you do have someone that needs more B17, maybe they do have some kind of a cancer happening and you want to get that B17 up a little bit to kind of try and get in front of that snowball, then you can give a capsule as well. And the capsule is just like concentrated B17 inside that capsule. So your dose is going to be anywhere from 5 to 10 seeds a day. Now you're going to want to start slow because the body has to break down that seed. Remember, it's going to break that down into those three components in the intestinal tract. And when it starts to break down in the stomach, for some people, it can cause a little bit of stomach discomfort. So don't start out like, oh, take 10 a day. I would not do that. I would say start with a few. Just do a few and see how the patient feels. And then as they do okay, you can increase, increase, increase. You actually can go up. I'm looking at my notes here. You can go up to, and I didn't say this, although this is a public forum, but 70 to 100 a day. But again, I wouldn't chew those. I wouldn't have the patient chew them because really you're going to get A, too full, B, get a bad stomach ache. So that's when you have an active something going on, then that's when you're going to want to convert over to that capsule form so that you can get the higher doses in the patient. Okay. So what we want to do is stick to about 100 to 200 milligrams of B17 a day. And that's a roughly, up to 10 of the apricot seeds. So it's a really easy thing that you can do that can help a patient who maybe it's safe as well. If they're undergoing chemotherapy or radiation, they can take the B17 while they're doing that. And it's just only going to help. It's just providing a nutrient. Remember, all we're doing is feeding, 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 feeding. And if by chance what we happen to be feeding them just happens to have another benefit, then all the better. That's even better. Then we're happy about that too. So we just want to think about how do we feed and nourish them. So the apricot seeds are very safe during chemotherapy, radiation, that kind of thing. Now, when you're putting a protocol together, and I'll kind of wrap up with this, when you're putting a protocol together for a patient that's dealing with cancer, I think my number one tip or strategy is do not overwhelm them. You want to think about what is the tissue that needs supporting. One of the tissues that's always going to need support is the liver. And the key herb there is going to be milk thistle. Milk thistle is great and it's safe to take. You can take it while on chemotherapy. Just take it lower doses, but you can do it. But what it does is it helps protect the liver. Remember, milk thistle is a liver protector. It also helps to break down environmental or exogenous compounds. So if you had a patient, let's say, that you suspect that they may have cancer because they live or work in the California grapevine valley where they spray pesticides all over the place, and so you suspect that their cancer might be from that, or it might be from a high glyphosate exposure or some other chemical or water exposure of something. Then milk thistle will be great because it not only protects the liver, but it's helping to break down those chemicals from the liver and get them out of the body. So I love using milk thistle with any patient that has cancer because it supports and protects the liver so well. So think about that. You might also think about like adaptogens. I love using ginseng with cancer patients or people that have, immune deficiency type things. Think about ginseng, and ginkgo. They both live forever. They're healthy, they're strong, they're robust. So ginseng, sometimes ginseng and rhodiola can be great. Rhodiola is a great stress and adaptogen. And, if you're sick, certainly your stress is going to be higher. So I wouldn't neglect that part of it because I do think that that's going to be really helpful. Of course, you're going to make dietary changes, but supplement wise, I think you could really easily do like vitamin B17, whether you give it to them in a capsule or whether you do the seeds. And you could also consider something like Essiac tea. So that has a long history of being effective for cancer patients, and they can just get it, as a tea. You could also use burdock. Burdock is a great cleanser. Red clover is also a great cleanser. Be careful with that one. But there's lots of things that you can do that won't overwhelm the patient. And then lastly, I would say, don't forget about, you've heard me say it so many times, don't forget about upper digestion. It doesn't do you any good to work with a cancer patient who has zero hydrochloric acid, whether that's because of age or stress, or they've just, eaten poorly and they've just really, really downregulated that production of hydrochloric acid in the stomach. It's so essential to be able to get that working because that stomach, your mouth and your stomach, that's 80% of your digestion. 80% of your food breakdown happens in those two places. And so we want to make sure that we have chewing, chewing, chewing in the mouth, lots of good saliva, and then plenty of hydrochloric acid and those other gastric secretions in the stomach. And you can really easily do that with bitters. And then what is B17? It's bitter. Do you see where I'm going? So I'm not saying that this is a cure all. Do not mistake what I'm saying. I'm just saying that this could be a really easy way for you to provide support for a patient that may choose to do conventional chemotherapy or conventional cancer treatment. And many people do. That's what I did with my daughter. And for some people, it works. And unfortunately, for other people, it might prolong things for a little bit, but eventually the breakdown in the body from the chemotherapy drugs, and I'm being careful what I'm saying here, just, if you can read between the lines here, but sometimes the secondary effects of those drugs can be what ends up killing them in the end, right? They end up dying from the effects of the chemotherapy. But what if there was something that was just super easy that you could do? Make sure that they have enough hydrochloric acid, protect the liver, support their stress, and then maybe just give them some B17. Say, here's a capsule. Go to town, friend. Have a great time. Let's see what happens. You're not going to hurt anybody. And then the other option are those alternatives that are coming around that were, made to be the bad guys during the COVID years, which is ivermectin, hydroxychloroquine, and fenbendazole. And fenbendazole is a veterinary medicine, but the hydroxychloroquine and the ivermectin both have anti-cancer research. So you might want to go to PubMed maybe and look those up because the more knowledge you have about how they work or that they work even, then when you have a patient that comes in, you can say, listen, I'm not treating your cancer. I'm not doing it. But what I'm going to do is give you some options. And these are a couple of really easy options that might work for you. And you could do them regardless of what you choose, right? I'm not asking you to throw away what your medical doctor is advising you to do. I am saying, here is a platter. You choose what you want to use and what you don't want to use. And it's okay either way. But the more that you know, the more that you can help those patients be able to make the decision that's right for them. But I think B17 should be a big part of that. I'll say those options. Let me say that one should be probably front and center because it's so, so easy. So in the show notes, I will link to where I get my apricot seeds, and my husband and I take them every single day, and he grumbles every single day about taking them. Grumble about how bitter they are, and I just wolf them down. I don't mind. I chew them up. I'll take them before bed. I don't care. Doesn't matter to me. So I'll put the links in the show notes where you can go get them. And I hope this was helpful for you. I thought that our conversation in Clinical Academy was so good, and we went a lot deeper into more things that I will not speak of in this forum. They were kind of private and on the down low amongst us girls, so to speak, in the community that we have there. But we had a great time. It was a great conversation, but this was just part of it and an important part. And so I wanted to share it with all of you today. So I'll also put the link for Clinical Academy. But if you want to go there, it's rondanelson.com/clinical academy. You will love it. There's no long-term commitment. It's $99 a month. It's easy. Just jump in. And if you love it, great, stay and hang out. If you don't, then that's okay too. Love you. We can still be friends. So I hope to see you inside Clinical Academy. And in the meantime, make it an awesome week. I'll see you next week on the podcast.